I'm Sherry.
And I'm Vicki.
Ask the experts from dentalxrays.info.
We'd like to demonstrate today some of the products from Dentsply Rinn, which will help you with your dental imaging. In this video, we're going to show you how to use the XCP-DS FIT system from Dentsply Rinn. This is to take your full mouth digital x-rays. The XCP-DS system is a universal autoclavable holder, and it works well with all the digital sensors in the market. An adjustable clip uses a silicone band to keep tension on your sensor as you're using it and working with it. The size 1 sensors, 1.5 DEXIS, and any size 2 sensors work and fit well with the digital fit. If you are using both a size 1 and a size 2 sensor for your full mouth series, this system makes it easier as you can use the same bite block for each sensor. Before using this system, load your sensor into a Relax Fit sensor cover. Then press the edge of the sensor against the clip, lift it up, and pop the sensor in. The Fit bite blocks are actually designed to work with a single color arm system or the 3-in-1 Aura system that is also designed by Rinn. If you notice, we have 3 different color codes for the 3 different areas of the mouth. The red will be for your bite wings, the blue piece will be for your anterior PAs, and the yellow will be for your posterior PAs. What I'm going to show you are some of the challenging areas using any type of digital placement, but I'll be using the Fit. Sliding the Fit in to the bite wing, and take your ring system. Notice it's red, so you're going to use the red prongs on the bar. Attach that and slide your ring according to the same color. So you're going to use the red. Slide this in. Always look through the circle to make sure everything is in place and that you can see your sensor right in the middle. Placing this, it's best to put the film or the sensor closer to the middle of the mouth. Retract the cheek, slide it way back there, and have the patient close and bite. Open. By allowing the sensor to be more towards the middle of the mouth, allows the patient to be able to actually reach down and bite right to the bite block and have no separation between the teeth. Usually bite wings are pretty easy. So the 2 on one side and then the molar and premolar on the other side, and you're good to go. Next step we'll do is the anterior PAs. You're going to take your blue bite block piece, use the blue prong, slide it into the bite block, attach your sensor. Now the last thing you want to do is attach your ring, again using the blue, which matches the blue, and you're going to slide that right under the bar. Also, when you're doing that, always double check again, make sure through the middle of the circle you can see that the sensor is right in the middle, so you have this put together correctly. This is for the anteriors now. So what you want to do is make sure you place the actual base of the sensor deep in the mouth to accommodate the whole bite block. Right, so as she closes, her teeth are on the bite block, and this is correct. What you want to do now is bring your cone around and actually follow the bar position with your cone, and you'll get the correct vertical tube angle. Open. You'll just need to reverse it actually to do the lower 2. You're going to take this base, put it between the arch as far back as you can so that it fits, roll the bar up, and then have her gently bite. Again, slide this up, bring your cone in, and follow the direction of the bar with your cone. Open. Notice on the Fit system here, we do have a bite block that's a little thicker than normal. This is great when you're doing the anteriors because you can eliminate having to use a cotton roll. The last area I'd like to show you is the posterior PAs. Select your yellow, which is for the posteriors. Use the yellow prong. Slide the prongs into the bite block. Now as you attach your sensor, make sure that the wire is going the same direction as your bar. Do not place it in this way, but this way. So just slide it up, attach it this way, wire sensor. The ring system, use the yellow because it's color-coded again. Slide the yellow piece onto the bar. Always double check again to see that it's right smack in the middle so you're not going to cone cut anything off. Now the way I have this put together, I can actually do her upper molar. So when you slide it in, make sure you're sliding it in that this instrument looks like a little V here. Retract the cheek with your forefinger. Really make a lot of room for the sensor because it is a little bulky. Stretch the cheek out so you are putting that bite block way back into the pocket. Have her gently close and you're ready for your molar. Open. The way this is put together, you can actually do the opposite quadrant right away. So what I'm going to show you is how to place it back on a lower molar. I usually hold this with my left hand and use my right index finger. This piece here must go within the cheek, so make sure you really make a nice pocket. The sensor itself has to slide right next to the teeth. So you got to stretch that cheek out, slide that sensor way back so that you're back by the molars holding the cheek. Once you get it in there, have the patient close, let go. Now you can bring your cone in, following the bar. Open. So you're going to do that molar, premolar, and then the molar and premolar on the lower left. Those two quadrants are done, and now you have the final two on the upper right and two on the lower left. To do that, though, you have to change this position the way that this is put together. I suggest first pull this bar off and put it actually onto the other side of the bite block. Also, you notice my wire is coming up in this direction, bar that way. So again, you're going to just slide this off and turn that also. So now you can see the wire bar. Last thing you have to do, though, is make sure that the sensor is actually positioned right in the middle, and it is not. So last thing, and now you're good to go. Now you're ready to go to do the upper right and the lower left. So this is using the FIT system with the oral 3-in-1 arm and ring. It's very easy to use, it's universal, fits any type of sensor and any size sensor. We hope that this demonstration did help you today.
And if you have any further questions, visit our website, dentalxrays.info, and click on Ask the Experts.